Good evening and welcome to the Ombudsman program. My name is Diane Welborn. I am the Ombudsman and I'm going to be your host for this evening's program. I am honored at this first show of the season to bring to you two representatives of the Five Rivers Health Center. I have with me tonight Gina McFarlane, who is the Chief Executive Officer, and we also have tonight Dr. Mamle Anim, who is the Chief Medical Officer. Thank you both for coming on the program this evening.
Thank you for inviting us.
I'm so glad to have you and to talk about the services that are offered by Five Rivers, which are vast and seeming like ever growing. Gina, I'd like to turn to you at the beginning to ask if you could provide for the viewers a bit of history about the Five Rivers Health Center.
Thank you.
Yes.
So we started as departments of Miami Valley Hospital and Good Samaritan Hospital. We were three departments that primarily served the underserved and uninsured patients within the community. Over the years, we've continued to have losses. We continue to see a growing number of uninsured patients. And so we approached Premier Health and asked them if we could break away from the hospital and to create a federally qualified health center. And so with their permission, we were able to spin off from the hospital back in May of 2011 to create Five Rivers Health Centers with the hope of becoming a federally qualified health center.
Well, that's quite a challenge in and of itself to become a federally qualified health center. It's quite a mouthful to say as well. So why don't you tell our viewers exactly what that is, since I don't think it's common knowledge outside maybe the medical arena.
So a federally qualified health center is a designation given by Medicare and Medicaid that allows us to serve patients and meet 19 program requirements. There's a grant that we receive. In addition, we also get the opportunity to serve more patients. And so some of the 19 requirements are that you have to see patients regardless of their ability to pay. You have to have a board that is made up of 51% of the patients that you see, that you serve, have to serve on that board. You have to provide a quality improvement program. You have to make sure you offer a sliding fee scale where patients can be accommodated. There are lots of other requirements, but an FQHC is a safety net provider within the community.
Okay, well, that's wonderful that we have that. How many such health centers do we have in Ohio, for example?
So within Ohio, there are 44 federally qualified health centers, or we call them FQHCs. Within Montgomery County, we have 2. And so we have Five Rivers Health Centers and then community health centers of Greater Dayton. But nationally, there are over 2,000 federally qualified health centers.
Yeah, 2,000, that's quite a large number.
It is.
Now, in the effort to become a federally qualified health center, I would assume it's a rather lengthy and thorough application process. Do you want to tell us a little bit about how that went and how long it took?
Sure. So because it's a federal government, you're talking about a lot of paper. And so our application was over 500 pages. We had to prove that there was a need within Montgomery County. We had to show that we had a response to the need. We also had to prove that we met all of the criteria, that we are a nonprofit organization, and that we're willing and we stand ready to serve more patients if the need arises.
Great. I think we're going to come back a little bit. I'd like to come back a bit and talk a little bit more about the need in the community with the both of you, but you might have something you need to say about that right now, about the need that we have in Montgomery County.
And so one of the things that we've noticed, and this was even before the Affordable Care Act, is that there were more and more patients who were uninsured or could not receive primary care services. And so we're talking about going to your family doctor, we're talking about geriatric care, pediatric care. And so we knew the need was there. And so what being an FQHC allows us to do is to see more patients. It also gives us an enhanced reimbursement for both our Medicaid and Medicare patients, but it also allows us to provide more services. And so as we've become an FQHC, which we became one 2 years after we had broke away from Premier Health, we were able to serve a large number of patients. And as we continue to grow, that number continues to grow too as well.
Oh, that's just wonderful. Now, there is something, I think we want to talk about the sites as well before I bring you in here with the residency program. So I think that at this time we do have a graphic that is a map of the sites of the Five Rivers Health Center that perhaps we could show our viewers on the screen while Gina's describing them. So go ahead, Gina. Where are the sites?
So we have 6 locations, and primarily we're seeing patients regardless of their ability to pay. And so we have one location that is not too far from Good Samaritan Hospital. It's across the street. It's called the Family Health Center. That's our newest site, not our newest site, but our newest location. And so we serve patients regardless of what age the patient is. We have the Center for Women's Health, where we see our OBGYN patients for obstetrics and gynecological care.
Excuse me a second. I'd like to leave the map up, if we could, a little bit longer so that people can see the sites that she's describing. Thank you. Go ahead.
And so the Center for Women's Health is located near Miami Valley Hospital on the corners of Wyoming and Brown Street.
Right.
We also have the MedSurg Health Center, which is at 725 South Ludlow Street. And then we also have our PEDS Center that's located right next door to the Center for Women's Health. And we have our dental site, which is located on Apple Street. And our newest location that just joined us is the Samaritan Homeless Clinic, which is located at 921 Edwin C. Moses. Right. It's like I'm trying to remember. It's north or south Edwin C. Moses Boulevard.
Excellent.
And so we're located all over the city, and patients are able to access our care when needed.
Great. Yes, thank you for having the map up there. We wanted viewers who are still looking for a medical home to know where these sites are, because you all are open and accepting patients, and the doors are open and ready to see people. The model for this program is one that's fairly unique, which is something people of Montgomery County kind of like to do. They like to make new inventions of ways to do things. And so I'd like you to provide a description about the involvement of our medical school residents in the operation of Five Rivers, please.
Yes, so Five Rivers is unique in that of all the FQHCs in the country, as Gina said, over 2,000, we are the FQHC with the most number of medical residents who are providers. I think about 95% of our providers are residents with Wright State University Boonshoff School of Medicine. Now, a resident is somebody who has completed medical school, graduated, and is pursuing a specialty, whether it's internal medicine, family medicine, surgery, orthopedics, pediatrics. So these are qualified physicians, and they are working in our centers with the Wright State University faculty supervising them each along the way. And so we've done this historically for as far back as we can remember, and 35 years plus. And so we are very unique. We have over 300 residents in all our centers, in scope and and out of scope. So that's very unique, this model.
It certainly is. And I'm sure that that brings certain advantages to the care that people receive there when you have the young, bright, recently graduated who know everything. So
exactly. Yes, so having residents, they keep the faculty on their toes. So residents are fresh out of medical school. They are still in a learning academic environment, and so they are continuously reading. And residents, because they're in training, tend to have more time to take care of the patient. So they have more time to spend with the patient. They delve into the history more. They are more up to date on the newest and the most recent study that said what. So a lot of times our patients actually get superior care because they have providers who are really deep in the books and trying to make sure that they are getting everything that should be done for them.
And at the same time, they are supervised by experienced faculty who are there to watch over everything that you're doing.
Yes, all the patients In primary care, every note that is done is going to be reviewed by faculty and signed off. A lot of times the faculty is going to go in with the resident and confirm some findings. And so the residents do have somebody watching over them, making sure as they grow. Most residencies are 1 to 3 years, some of them are 4. So as they progress through the years, the patients will find, and the patients like that because they have somebody, they work with them right from the beginning and see them grow and see them mature. Patient will find that the level of supervision and the level of hands-on from the preceptors may reduce as the resident matures in their knowledge.
That's wonderful. And I'm sure then that with that time frame, I'm sure there's certain important relationships that develop as in any doctor-patient relationship with these residents.
Yes. Every patient in primary care is assigned a primary care provider, and so the residents are designated as their primary care provider. So they do develop a relationship with these residents over the 3 or 4 years that they are in training. These are these are their doctors. This is who they bond with. This is who they see on a regular basis. And so, yes, for the patients, they actually have a sense of pride too in saying, hey, I worked with this resident. We've had patients say things like, bring me a new one so I can train them. So, so the patients are actually part of the process, and they really do take ownership of their new intern and kind of watch them blossom to be the physician before they leave.
A very, very interesting model. I think that is great. Do you know if many of the residents remain in our area? Do you see a lot of them as you live your life in our community? Have they gone on, or do they part of them move off and part stay?
Depending on the specialty, family medicine residents they stay in primary care. A lot do stay in the community. Some, of course, as you know, would leave. Internal medicine residents, typically 50% of them will go into fellowship training, which is extra training after their residency program. And then in this day and age, a lot of our residents are staying and working as hospitalists because, these days outpatient doctors stay outpatient, and then there are doctors in the hospital who take care of the patients in the hospital. So we do have a lot of them staying in the community and sending patients to us as they see them in the hospital.
Oh, that's really good. That relationship can in some ways carry on, as they're kind of also alumni of Five Rivers Health Center as well as their medical school. You touched on it a little bit about services for those who are really needing the kinds of services and access to health care that has been increasing recently. But tell us a little bit about who is eligible to come and be served at Five Rivers Health Center.
So our patients, we're willing to see any and anyone.
Okay.
If you have insurance or if you don't have insurance. Within the Affordable Care Act, it has allowed us to transition lots of patients who have been uninsured to become insured. And so what we've seen is that someone who didn't realize that there was an insurance available out there, we have outreach and enrollment counselors who will walk that patient through the necessary steps to get them on insurance. And so even before we go through the huge open enrollment that's going on, there are a lot of patients right now who qualify for Medicaid. And we'd love the opportunity to talk with them to see if we could help them out and to see if they qualify. The greatest number of people that we've seen transition from being uninsured to insured are actually men. And so that's been a great opportunity for us to get more men to take ownership of their health now that they have insurance.
No, that's wonderful. So just want to make sure our viewers understand clearly that even if they have made an application and don't have coverage yet, or if they've never made any application for health care, that process is something that they can receive help with when they come to Five Rivers.
Absolutely.
That should not stop them from trying to make an appointment and coming on in. And
absolutely.
That's important because for many people it's a complicated process.
Absolutely. So, but our counselors are there to guide them along the way.
That's great. Excellent. I'd like now to talk a little bit about the specialties of care that are provided at Five Rivers, and we also have a graphic for this. It is the current programs, first slide entitled Current Programs. So why don't you walk us through all those services that are on the slide?
Sure, and so I've talked about the Center for Women's Health, dental, our Family Health Center, Med-Surg Health Center. At Med-Surg, we also provide an adult transitional sickle cell clinic, where in the past, sickle cell has been a disease where a lot of children at the time really didn't survive beyond the age of 18. And now with more technology, better medications, more therapies, a lot of those children are now adults with sickle cell. So we have an adult transitional sickle cell program that helps the adults move from children's to the primary care world. We also have a transitional care clinic where we see patients who have been discharged from the hospital in the past 30 days. And we want to make sure that they don't return as an inpatient or to the emergency room. And so we provide care for them too as well. We've mentioned pediatrics, and we also mentioned the Samaritan Homeless Clinic, which has a variety of services there. They provide medical, dental, vision, psychiatry, mental health services, substance abuse services, and recuperative care too as well. And so they do the whole gamut. And then we also, you'll hear where we'll say in scope or out of scope. And in scope just means that it's under the federally qualified health center umbrella. Those that are out of scope are still a part of our program, but they're not part of the FQHC. And so the last specialty that we have that's in scope is our Hematology Oncology program. And this was before we knew the Affordable Care Act was going to pass, and that we have a lot of patients who get chemo, who have cancer and need chemo. And so we wanted a way to make sure that patients didn't have that burden of paying that large chemotherapy bill. And so we've created the Hematology Oncology Clinic, where patients are seen by the physician, and then they also can receive their chemotherapy through the infusion center that we have on site at our 725 South Ludlow location at Med-Surg. And so our specialties include, which is I think hopefully the next slide,
yes.
is
the next slide is yes, the non out of scope, services.
Correct.
Right.
And so this includes our GI clinic, where we have fellows and all of these specialties who help patients as well as residents. We have orthopedic, we have general orthopedic as well as hand surgery. We have general surgery, and we also have neurology too as well. And I think infectious disease too as well. And so all of these specialties have been a part of Five Rivers since the beginning, and they were a part of all of these sites when we were a part of the hospital. And we just felt that it would be great to keep them under the one umbrella so that patients have the access that they need.
That's wonderful, thank you. Is there anything you'd like to add about any of those particular services?
I think that it's really vital when you have primary care to be able to have a referral base. And a lot of times in clinics like this where you have the underserved, the uninsured, it's very difficult to get them in specialist offices. And so that's one of the unique things also with Five Rivers, in that we have specialty care that we offer to our patients in addition to the primary care.
Yeah, that's a very good point. So they can certainly access that as well. And we also want to talk about insurances. We talked about everybody that's eligible, but we want to talk about all the insurances and coverage that are out there. That's another complex part of the field that you're in. So we have a slide that depicts that. It is the slide entitled Payer Source. And that's up now for the viewers, and I'll let you say a little bit about what that bar graph is showing us.
So as an FQHC, one of the main things that the federal government wants us to do is to see patients who are on Medicaid and Medicare. And Dr. Anim touched on this, in that there are a lot of providers in the community who do not accept Medicaid. They may accept Medicare, but they don't accept Medicaid. And so as an FQHC, we're encouraged to see as many Medicare and Medicaid patients as possible. And so what the graph is showing, that when we first started, we started at about a little bit over 40% of our patients had Medicaid. Through the Affordable Care Act, we're now up to almost 70% of our patients receiving Medicaid. And so for us, that's great, because now more patients are insured, as well as the fact that it allows us to see even more patients. And so you'll also see our Medicare numbers. And so Medicare is primarily for patients who have insurance and they're over the age of 65, or they may have some other disabilities. You'll see self-pay. Again, self-pay is someone who's uninsured, and as you can see, the numbers have definitely gone down from where we started. We were over 40%, and now we're down to about 10% of the patients that are uninsured. So again, it's those outreach and enrollment counselors that have been able to help them get onto Medicaid or some other type of insurance. And then lastly are commercial patients. And so that's really hasn't been a large part of our population, but most private physicians will see commercial insured patients. And so it's not our specialty. Our specialty is really taking care of those Medicare and Medicaid patients so that we can provide the overall services that they need. And so what makes us a little bit different than a private physician's office is that we also have a social worker who's available to help with some of the issues that a patient may have. We have a dietitian on staff. We have a behavioral health consultant who will also provide care on site in a private, confidential manner.
That's wonderful that you have all of those services available. I wanted to also ask you about the health indicators that have recently kind of been released. They come out in so many studies every year about health indicators. And in Montgomery County, I think we have quite a few that we should touch on tonight that are really important that a place like Five Rivers is addressing. So why don't you give us a little background on that?
Yes, so we can start with the top 10 leading causes of death in Montgomery County. And if you look at those, cancer, heart disease, accidents, chronic lower respiratory disease, Alzheimer's disease, stroke, diabetes, influenza, pneumonia, kidney disease, and infections of the blood. So these are the 10 leading causes of mortality in Montgomery County. And looking at what we do at Five Rivers and the quality that we monitor, we are monitoring at least 6 to 7 of these in our quality indices. And so for cancer, we are monitoring our quality on PAP and colon cancer. In Montgomery County, lung, breast, and prostate cancer are the leading causes of death in our county. Heart disease, we are looking at our hypertension, the control of cholesterol, diabetes. We're looking at patients who smoke and trying to get them to quit smoking. Obesity rates are something we are monitoring. Chronic respiratory disease, lower respiratory disease, really directly linked to smoking, and that's another thing that we're looking at. And also we monitor our asthmatics, our chronic persistent asthmatics, making sure that they are on the correct medications to reduce their flare-ups. Stroke, hypertension, cholesterol, we monitor aspirin use, and again, smoking is a risk factor. And then kidney disease ties into all of this. So we are really trying to impact these leading causes of mortality in our county, monitoring the quality, giving feedback to our providers, saying how can we do better, and then remeasuring it. And over the years, we have shown that we are improving the quality of these indices in our patients.
Wonderful. And of particular concern, I think, is infant mortality. I think we'd probably like to hear what strategies and successes you all have been working on in that, addressing that problem.
So within Montgomery County, we're looking at the latest numbers are showing about a 9% infant mortality rate. For African Americans, it's almost 19%. For Caucasian Americans, we're talking about a 5.3%. All of those numbers are bad. Within the state of Ohio, we are the 48th worst infant mortality state within the country. And so, unfortunately, Montgomery County, even though the numbers for Ohio got just a tad bit better, we were like the 49th, there are 3 counties that infant mortality rates actually increased for the latest data that we have, which is 2013, and Montgomery County was one of 3. And so one of the things that we've wanted to do at Five Rivers is to really try to come up with, we're calling the kitchen sink approach of infant mortality. At our Center for Women's Health, we see over 1,000 women who are pregnant. And so what we're doing is, through a grant that we received through HRSA called the Healthy Start Grant, we are one of 4 4 sites within Ohio that received this grant, and one of 11 within the Ohio and Michigan areas that have received this grant. We're using those grant dollars to really try to attack infant mortality. And so the way in which we're doing that is we're engaging the patients in their care. We're incentivizing them to come to their appointments, come to all of their appointments. And what we know within 5 Rivers is that if that mom comes to 7 or fewer visits, the likelihood of not having the best outcome is going to occur, meaning it's going to be a low birth weight baby, a very low birth weight, or the baby unfortunately may die. And so that 7 visit number is really the gauge that we use. And so we encourage them to come to all of their visits, to stop smoking, to engage in their care. And one of the ways in which they can engage in their care is to participate in our Centering Pregnancy program. And so it allows pregnant moms to be in a group setting to talk about their care as well as receive their care too as well. And so we're monitoring about 10 different things. And what's been fabulous is that we also have the data to show that the things that we're doing are making a difference. And so in the first 9 months of our program, from September of last year to May of this year, we did not have 1 infant death.
That's wonderful.
We saw over 900 women and children who we looked at all of their care, and we exceeded the numbers that the federal government wanted us to have. We also had the opportunity to really show moms what's best for them and what's best for their baby. And so we provided waiting room educational opportunities. And so sometimes, we've been to the doctor and you have to wait a little bit of time, yes, unfortunately. And so what we've done is we've used that time to actually create a waiting room educational opportunity. And so moms and their dads are learning about what it means to have a sleep-safe environment, of making sure the baby is on its back, that the baby doesn't have a lot of fluffy stuff in the crib. So all of those things are really making a difference. And so we are proud of our numbers, and we're waiting to see what this next year holds. But we know that within our region, we have the 3rd largest number of people enroll in this Healthy Start program, which exceeds other programs that have been around for 25 years. And so we're excited about what the next year holds, of how we could impact even more lives.
That's great. I am being told that we have a caller. So you're on the air. We'd like to hear your question.
Yes, thank you for the program. I'm so impressed with the work of the health center, the fact that you have counselors and social workers, and that you're engaging constructively with the Affordable Care Act. My question relates to childhood diseases, and I'd like to hear a little bit more about what diseases you're seeing appearing among children in the schools in our area, and what your efforts are in that regard.
Thank you very much for your question. We'll let you go now, and we'll answer it for you. All right, ladies.
So I think generally the great thing is children don't have a lot of chronic medical problems. So that's wonderful. In our setting, we tend to have a younger population, so we don't have as many adolescents. We have a lot of very young children, and probably getting to 9, 10. And because we're a new practice, I think we are growing with our practice. Some of the diseases one of the big ones we see is asthma. Asthma in children there's a high incidence, and in this area, asthma is a problem. So we have a lot of asthmatics. We also tend to have a lot of ADHD cases that are seen in our pediatric center. And then really after that, we have some diabetics, but we don't have a lot. We have obesity in children. That's a big thing that we have, our providers see a lot of. And with obesity, they have issues with high cholesterol and sleep issues and all that comes with it. So those are the big ones. I think that would kind of wrap up what we see a lot in our practices. We do monitor the quality of the asthma, as I talked about. We also monitor childhood immunizations, and that's one area that if you're doing that well, hopefully you are preventing infections and diseases in the children that you're taking care of.
Okay, well, good. Thank you for answering that. The caller did also make one reference, and I wondered if there might be a plan to cooperate with some schools. Is that to get to more children and more teens and more people? Yeah.
So that's a fabulous question. One of the things that we're hoping to do is to partner with other organizations within the community. In particular, we're actually working actively with the Trotwood school system to look at creating a school-based health center. And so again, that falls under the federally qualified health center realm. Within Cincinnati, they started with 2 school-based health centers, and now they're up to 21. And so there's a contingent of people from Trotwood, Community Health Centers of Greater Dayton, 5 Rivers, that are all going to Cincinnati to see what they're doing to really make an impact on the health of children in the schools that they are. And so we know that Cincinnati has seen a decrease in the number of absentee days. They've been able to improve the health of kids. And so we know that Columbus is also exploring this too as well. And so we look for the opportunity where we may be able to do the same thing here within the Dayton area as well.
Well, good. Then we'll look for that in the future. Then we'll come back to that. I'm not sure we were completely finished with the infant mortality discussion. Was there more that you wanted to add about successes and some of the programs that you're providing for parents?
And so we have essentially 2 ways of engaging parents. We are engaging them on the prenatal end, and then also after the baby is born, after the child is born. So we're going to monitor them for the next 2 years, well, almost 3 years, from the pregnancy, from prenatal until the child more or less graduates from our program. But what we're trying to do is to really make sure that both the mom and the dad are engaged in the care. And so we've created also another program called Centering Parenting that, again, provides parents in a group setting, talks about the care, provides parenting education materials, but you're also getting that well-child visit all at the same time. So that allows us to also provide care. We have the opportunity to also create Montgomery County's first diaper bank. And so for a lot of parents, you can get medical care, you can get child care, or you can get help with WIC services as far as nutritional services, but no one really helped with diapers. And if you haven't been to the store lately, diapers are extremely expensive. And so we created a diaper bank specifically geared to patients who are in the 7 zip codes that the federal government has asked us to key in on, because they've had the highest infant mortality rate historically. And so we work with partner agencies, and so they too can benefit of helping parents within the community in obtaining diapers for parents. And so we ask parents to engage in the care, to come to the visits, and if they do, we would provide diapers and then other types of incentives too as well. Right. So even though we're doing well, we still have areas that we're struggling with, and smoking in pregnancy still is a tough one, and we'll continue to create some new opportunities to try to help moms put those cigarettes down.
Okay. Anything else to add on that topic before we move?
I think she said it all.
You got it. Okay, very good. Good work. 5 Rivers is also a patient-centered medical home. I'm not sure everybody exactly understands what that is, what that means, how it impacts the practice, and how the patients are then involved. I'd like to hear you discuss that a little bit.
Okay. So 5 Rivers is a patient-centered medical home. 4 of our locations are patient-centered medical homes, and I'm going to say PCMH from this point forward.
Okay, PCMH. You're hearing patient-centered medical home, so we won't stumble over that.
So this is a designation that you actually put in a pretty intensive application to the NCQA, which is the National Committee for Quality Assurance. And there are 3 levels of recognition, 1, 2, and 3. And we're pretty excited about the fact that all of our 4 sites that have the designation are level 3 designations. These are the Homeless Clinic, the Medical Surgical Health Center, the Family Health Center, and our Pediatric Health Center. So what does being a patient-centered medical home mean? Really, if you think about healthcare today, it is very fragmented, and there are just so many things that a patient has to do, and everything is sort of in its silo. So a patient-centered medical home is a concept in which you want to put your patient in the middle and have all the support services around the patient and help the patient get to these support services. You want to engage the patient in their care, so have the patient participate in their care, have the patients tell you what we ask our patients, what do you want to see improve about your hypertension or your diabetes or your smoking? What do you want to do different? And so then the patient picks a goal, and then our role is to support the patient. Patient-centered medical home focuses on access. If you think of a healthcare, it's always been, we're open from this time to this time, you fit in. You're sick, well, our appointments are full. Think about it, come later. And when you're sick, you're sick. So PCMH says you need to be accessible to your patient. You need to have same-day appointments available. You need to have after-hours access. When your patient calls, you want them to be able to get in. So we have good access. It wants you to know your patients, know the demographics of your patients, know what is going on in your patients, know the top 10 diagnoses your patients are having, so that you can focus your efforts on those to reduce that. Monitor the quality of what you're doing. Try to keep your patients out of the hospital. So if your patient is admitted, your patient is in the emergency room, you should know about it so that you can reach out to them and say, hey, you were in the hospital, what happened? Come in, let's try to figure out so that you don't need to go in there. So it's about access, it's about knowing your patient demographics, having the patient engage in their care by having a goal, knowing where they are, and then when you do all these things, the quality, measuring the quality and showing that you're improving the quality of the care that you're providing to your patients.
Okay, that's very thorough and excellent. How are the patients responding?
Actually, patients love it. It is so amazing to hear patients say, when I came in, they asked me, what do I want to do different about my smoking? And I said, okay, I'm going to cut back. When they come back, they want to tell you what they did. So it comes from the motivational interview. Instead of us always telling, do this, do this, do this, what does the patient want to do? Because guess what? They live with themselves 24/7. and they actually may know something that they can do or something that might actually work better from them than what we tell them. And so patients are excited. We get good feedback. Patients have lost weight. Patients have reduced their blood pressure. Their sugar control is better. They've quit smoking. They've just been very excited in this program. And sometimes patients are like, I want 5 goals. And you're trying to say, why don't we just why don't we pick 1 or 2 and yes. But you see, it really gets them to be part of the care, which is really what is missing in medicine traditionally as we practice it.
And all of this patient-centered medical care is taking place within a framework with residents working with the patients that come.
Yes. And so that's wonderful because we are teaching these physicians of the future these ways of taking care of patients, and we're hoping that when they leave and wherever they go and wherever they practice, they're going to model some of these things and take it to their future practices and spread this all over the country.
Great. And you are obviously pleased with the movement of the needle for the health of the patients. Then it's working in that way as well too.
And that is the whole goal, to improve the health of the patients. Yes.
Right. Exactly. That's wonderful. Great. Are people making good choices for the most part? They are. Then you're seeing this.
They are making good choices. It's not easy, but people are glad for the opportunity to say, hey, this is what I want to do. And part of the patient-centered medical model is, if you choose to say, I want to quit smoking, we're not going to say, great, go try and quit smoking. We're going to say, okay, so how can we support you? Maybe there's some smoking cessation classes we can refer you to. Maybe we can help you with some patches. Maybe we can get you into. So how can we support with community referrals, in-house referrals, to get you to achieve your goal? So getting all of that together as a team is really what makes the difference.
Which kind of goes back to your comment earlier about having the accessibility of all of these various types of therapies and interventions. Yes. Mm-hmm. Now, is a patient-centered medical home, is that evaluated in a different way? Is there a whole different scale or whatever or indicators for that?
Well, to get the designation, you do have to show that you're doing all these things, collect the data, report the data, and it's really a pretty tedious application process. Now, at any time, they could just choose to come and audit you. And then you have the designation for 3 years, and then after that you have to reapply and get your designation again. And as you well know, in 3 years the rules would have changed. And so we're going to have to do, but it's good in that it keeps you on your toes, it keeps you innovative, and it keeps you trying to do better for your patient all the time.
So is Five Rivers in the first, second, or third year of having level 3?
The 3 locations, Family Health, Med-Surg, and Pediatrics, received the designation in March. The Samaritan Clinic...
No, June.
In June. Actually,
yes.
You turned it in March, received it in June. But the Samaritan Homeless Clinic is in its 2nd year of designation. Yes.
So that's the highest level possible. That's wonderful, and then that will be reviewed in a couple of years. So good.
Mm-hmm. And there are not that many practices within the Dayton area that have that designation. So we're extremely proud to have that. And, you know, even though I mentioned the 500-page application we had for FQHCs, we're like a baby in comparison to the application we submitted for the patient-centered medical home. I think you had like 3 notebooks of about 500 pages.
Very clinical, very clinical data. And to whom are you submitting this?
To the National Committee for Quality Assurance, the NCQA.
All right.
There are different organizations that do the PCMH designation, but this is the one that HRSA recognizes, and so that's why we used them.
That's the one that you chose. That's wonderful. As we talk about the top 10 causes of death that you mentioned earlier, do we then see with the patients choosing what they're wanting to, where they're wanting to make improvements? Are there correlations with those top 10 issues you mentioned?
Yes. So when we in our application we had to pick 3 areas to focus on, and so we picked smoking, hypertension, and diabetes, because when we looked at our patient population and we looked at our top diagnoses, that was really up there. And if you think about the top 10, those 3 conditions impact a lot of the conditions in the top 10. So those are the 3 that we focused on. Ideally, I think what a true patient-centered medical home will be is, no matter what your patient has, ask them what do they want to do about it. But we focus on those 3. So if you have those 3, you've picked a goal, we're following up your goal, we're asking you about it, and we're kind of working with you on it.
Right. Good. Patient-centered, person-centered. Very, 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 very good there. All right. We've already talked about Five Rivers accepting new patients at all the sites.
Absolutely.
Yes. Now I want to talk a little bit about the progress that was made with the new building. People need to know about this new building, and I'm not sure if I think we have a picture. I think we have a graph of the new building that I'd like you to try to find. Yes, we have it up. So this was a long time in coming.
It is.
It was a dream that's now been realized.
Absolutely.
Right? Tell us a little bit about building a building while you're running a healthcare, running Five Rivers.
And so we have a great partner of Good Samaritan Hospital that has been working with us for a while to create this building. And the challenge that we have is that we have 30 family medicine residents. And during any given time, we can have up to 10 residents at a time. And we also had some of the faculty members at Wright State that also wanted to see their own patients. And so our previous building had 16 exam rooms. So if you kind of do the math, 16 exam rooms, 10 to 12 providers, you only have 1 exam room or so for each provider. And so we've been requesting for a while just the opportunity to move into a new space. And so we thought we were going one place and that didn't work out. But Good Samaritan Hospital was gracious enough to allow us to build directly across the street from the hospital in their flat parking lot, this brand new center that you see. And it is a fabulous building. So we went from 16 exam rooms now to 34 exam rooms. We have a wonderful conference area for the residents. to learn in, as well as a smaller conference room for us to have our meetings, our board meetings, and other kinds of patient educational opportunities. So we went from about 9,800 square feet to 27,000 square feet. And so we are beyond excited about being in this new space, and we're accepting new patients. And the telephone number to reach them is 734-4141. And so we're accepting new patients, not just there, but at our Med-Surg Health Center, as well as our Center for Women's Health. And the number for the Med-Surg Health Center is 208-2004. And for the Center for Women's Health, the telephone number is 208. I'm going to cheat because
it's okay.
And I want to say 208, 2007. And as well as pediatrics, 208-2781.
All right. That's a lot of numbers, so I want all the viewers to know that you can call Five Rivers and they'll give you any of these, or if you have our phone number, you can call my office and we'll have these numbers as well.
And they can also go to our website at www.5rivershealthcenters.org.
Well, that's really wonderful then. We have a little bit of time left, so I'd like to also ask you to address some of the major accomplishments that Five Rivers has made, so the viewers can hear about that. And we do have a slide that addresses the accomplishments, if we could put that up now. Very good.
So becoming a federally qualified health center is just a major accomplishment. Within Montgomery County, previously the Samaritan Homeless Clinic was the largest and the longest running FQHC, but they only served a special population, which were the homeless. And then community health centers came on board, and then Five Rivers. And so even though the homeless clinic has merged under Five Rivers, we have the two of us, but we are probably the babies within the state, meaning that we haven't been around as long as maybe Lincoln Heights, that's been around for almost 30 years out of the Cincinnati area, or some of the other programs. And so we came late to the table, but we're proud to be a federally qualified health center in this area. And so it allows us the opportunity to expand, to provide more services, to look for more opportunities to partner with other organizations to provide great care to our patients. So we're really excited about that. I just talked about the Samaritan Homeless Clinic joining us. They just joined us about 2 weeks ago, and they've been fabulous to work with. The homeless clinic, for most people in this community, don't realize it is probably the most comprehensive program for a patient. For you, I don't know about you, but when I go to the doctor, I can't see just the doctor. I only see just the doctor, but you can see the doctor, the dentist, the mental health therapist, the substance abuse counselor, a social worker. We can provide pantry care. We do the whole gamut. We also have the opportunity to receive funding for the Healthy Start, which we talked a little bit about. And collectively, we've been able to bring over $2 million to the Montgomery County community through federal dollars. So we're excited about all of that.
Those are wonderful achievements. What's the vision for next?
So our board has given us a challenge to look at 6 components, and Dr. Anim will help me if I forget something. But our board has asked us to look at providing even better quality of care. And so we're going to focus on really excelling in the quality of care. We want to make sure that our patient flow is intact. And so sometimes with the resident, because they're spending a little bit more time than you would spend in another doctor's office, they may forget the fact that we have 2 other patients who need to be seen. So we're going to put some time and attention on patient flow. We're looking at trying to make sure that we not only improve the services that we have at our sites, maybe expand a little bit more internally, but also look at maybe expanding into another county as well. There are a couple of counties surrounding us that do not have federally qualified health centers. So we're going to use that as an opportunity to grow. Did you remember?
I think becoming financially viable, even though Gina said we have $2.2 million, we're a pretty large organization. We have a lot of patients. We provide a lot of services that we don't get reimbursed for. And so this is one of the charges of our board, to continue to find more grants and find ways to become more financially viable. And then one of the things that our board wants to do is tell our story better. So this is a great opportunity for us to do it, to let the community know about Five Rivers and what we're doing, and so kind of get some more publicity so that hopefully we get more patients to come and see us at our facilities.
Well, I certainly think that those that drive on Philadelphia will want to pull it. It's a very beautiful building that you have there, and congratulations in accomplishing all of that. So we don't have a lot of time left here, so I just want to give you the opportunity, if there's something I haven't asked you, that I'd like you to take a moment just to comment.
The one thing we did not say anything about is our 340B pharmacy.
Oh,
yes. As a federally qualified health center, we do have a pharmacy on site at our MedSurg location where we have discount prescriptions available for our patients, and we get a lot of patient testimonials of how something was $100 and they came over and it was $10. So we do provide these discounts that we pass on to our patients. Unfortunately, this pharmacy is only for patients who are being seen at our in-scope clinics. We do not provide, we're not an open pharmacy. You cannot come off the street to use it. It's for our patients, but it's another way that we are helping our patients take better care of themselves by providing them with affordable medications.
Access to affordable medications is important in all these diseases that you've mentioned for us. Yes.
Absolutely. And they also have a special recognition nationally. They're known as a peer-to-peer site. So they're one of 13 peer-to-peer sites within the whole nation.
What is a peer-to-peer site?
So they are an expert in what it means to be a 340B pharmacy. And so our pharmacist travels the country as well as provides webinars all over the country on how to become a compliant 340B pharmacy. And so we're very fortunate to have her and her staff who provide excellent care to our patients.
That's great. Are the for the in-scope services, which we already had a slide on there that showed us that those patients can access this pharmacy. Is it something that is delivered to people on all the sites, or do the people need, is there 2 locations? How do they get to this?
So as Dr. Anim mentioned, we are only located at 725 South Ludlow Street. But our hope is to actually provide delivery service to patients' homes. And so we are hopefully expecting some additional dollars that will allow us that opportunity to grow.
I'm sure that would be appreciated by many. And in turn, is there something that you would like to add in closing?
We've said a lot, and so if anyone wants to look at our website, again, www.fiverivershealthcenters.org. You can schedule an appointment. You can see where all of our sites are located. You can learn more about being a patient-centered medical home. And hopefully in the near future, you'll see additional information of some of the new services that we will be offering our patients.
Oh, wonderful. Thank you very much for coming on the program, and thank you for all the work you're doing to serve the need that we definitely have in our community with these populations and these illnesses. So we appreciate it. Thank you very much.
Thank you for the opportunity.
And thanks to the viewers for watching. Good night.